This is the Uptick Network Stock Day podcast, sponsored by InvestorsHangout.com. Penny stock news and interviews from the microcap world. Public information on OTC, pink sheets, and microcap stocks from around the world. With your host, Everett Jolly.
On today's show, we have a very exciting guest with us. He is Dr. George Anastassov. He is the CEO of Axim Biotechnologies. George, thank you and welcome to the show.
Thank you for having me.
You know, give us a little bit of background of yourself and a little bit of background of your company before we get into everything.
Sure. Well, I am by education a surgeon. I hold a medical degree, a dental degree. I was trained in general surgery, in maxillofacial surgery, and culminated with fellowship in base of the skull and craniofacial surgery. I also hold an MBA, so I'm a businessman as well. So I guess I come from a doctor background and business as well. About the company, we started with a colleague of mine, Dr. Philip van Damme, who is also a craniofacial surgeon from the Netherlands. The idea of procuring new analgesics, new painkillers, somewhat 14 years ago, because we were quite aware of the negatives, of the side effects of the two classes and of available painkillers today, which are either opioid derivatives or non-steroidal anti-inflammatory drugs, or the combinations of the two. So as you know, opioids is a pandemic in the civilized world. For example, in the United States, every day 42 people die from a prescription or drugs overdose. And we recently, when I say we, I'm a member of the American Pain Association, wrote an open letter to the President Obama and to the Surgeon General outlining this particular disaster and that there is something should be done to decrease this epidemic. So we were looking for painkillers which are just as efficient as the ones available today or back then 14 years ago, but without the side effects. So what are the side effects? Well, opioids need to lead to addiction, from constipation to addiction to death. And, of course, non-steroidals are associated with bleeding, gastrointestinal bleeding, cardiovascular events, cerebrovascular events, and so on. And the combinations have both, of course, side effects. So we were looking into what can we do, what can we develop that is safe and is effective. We knew about cannabis. It's been around for some 6,000 years. So we said, well, okay, we know it works. We know that people smoke it to alleviate pain. Smoking is not good. We are physicians. So we were looking for different delivery mechanisms to consistently and predictably deliver these compounds. And we didn't reinvent the wheel. We looked at the Nicorette product, which is nicotine in a chewing gum. So we said, why don't we try to come up with a control release mechanism for delivery of these APIs, which are the cannabinoids. So that's how we started some 14 years ago. We spent our own money to do research and development and to file for patents and so on. And in year 2012, we created a joint venture between our Dutch entity, which is called Sanamat Holding. It's an intellectual property holding company, and the first publicly traded medical marijuana company in the United States, which is called Medical Marijuana Inc. We created a private entity called Kenchu Biotech LLC, which held the license for our first patent, which is for cannabinoids contained within chewing gum, control-release chewing gum, so it's not just a regular confectionery gum. And eventually, 2 years ago, in April of 2014, we bought another company which was publicly traded called Axim International, which was involved with alternative energy sources. And since we do have also a product for alternative energy, we thought it will be a good fit. We bought the company, and it became Axim Biotechnologies, which is a biotech company, pharmaceutical company. And we work in multiple directions. We have a pharmaceutical division. We have also consumer product division. And we work with different cannabinoids, with psychoactive and without psychoactive cannabinoids. We have a product on the market which is called Can Chew Gum, which is a chewing gum containing 10 milligrams of cannabidiol or CBD. Buzzword lately, if you watch the documentaries of Dr. Sanjay Gupta, where he was showing these little children suffering from retractable epilepsy, not amenable to any treatment, when they're having up to 300 seizures a day, and how a compound called from Colorado called Charlotte's Web, which is a cannabis plant, variety, which has very high levels of CBD, cannabidiol, and very low levels of THC, which is a psychotropic component, virtually cured these little children. So this gum contains CBD, but which is not extracted from cannabis. It's extracted from marijuana. It's extracted from industrial hemp, which renders it totally legal in all 50 states of the United States. So we sell in all 50 states, and we sell also within 40 countries worldwide. So that's our commercial product. We have formulations and patents for everything from toothpaste to mouthwash to even dental floss impregnated with cannabigerol. We are working on our lead product. It's actually called MedChew RX, which will be entering phase 3 of clinical trials and probably will complete it before September of this year. And this is also controlled release, a chewing gum containing equal amounts of THC and CBD, 5 milligrams and 5 milligrams, and it's intended to treat patients with chronic pain and spasticity due to multiple sclerosis. We are working on a dermatological project right now, which is happening as we speak in the Netherlands, in The Hague, for treatment of psoriasis and atopic dermatitis, also known as eczema, debilitating diseases. People commit suicide from psoriasis, and so far our preliminary data is very promising.
Well, let me interject here just for a second. So you have the FDA, and then you have the EU over there. These products that you're talking about, your intellectual properties that you're bringing to marketplace, do they have to go through a process of clinical trials in order to get approved, or can you fast track them? Give us the...
Sure. I'll give you the regulatory mechanism.
Yes.
Well, in Europe, we have the EMA, which is the European Medicines Authority,
right,
which is American counterpart. So any medication with claims, whether it's in America or in Europe or elsewhere, has to go through a regulatory process. So, for example, the trial that I was just explaining to you is going through EMA and FDA. So before this goes on the market, and hopefully it will happen before the end of 2017, it absolutely has to go through EMA and FDA. So it will go on the company that runs our clinical trials, our contract research organization. The name is QPS. It's one of the largest and most reputable firms in clinical trials. They absolutely will file an NDA with FDA and EMA, and once it goes through EMA, it will also have to go, of course, with the individual countries in Europe. But yes, this is the regulatory path. If we're talking about a topical application, then it's a medical device. It is not a pharmaceutical product. It goes through a different regulatory pathway, which is much faster. It may take as short as 6 months to approval. But everything that has claims attached to it absolutely has to go through FDA and EMA and the national regulatory agencies.
Now, how about your chewing gum? Did that have to get approval? Is it already approved? Is it a commercial application? Are you getting revenues on that right now?
We're talking about the Can Chew Gum with
yes.
CBD? No, this is totally nutraceutical without any claims attached to it. But people who know about CBD, I mean, they know what it does, but we are not making any claims whatsoever. So it's a totally nutraceutical product. It's the same as if you buy caffeine-containing chewing gum or green tea-containing chewing gum. So there's absolutely no claims attached to it. Now, we're working on other gums which are coming with specific claims. We're working on a project for IBD, IBS, and Crohn's disease, which involves not only chewing gum, but other application as well, the Flotex capsule, which is another intellectual property, and suppositories. We are working on the chewing gum for pain and spasticity, which I mentioned, which is absolutely with claims attached to it. And so we are working on a study for drug-related psychosis, which will have, of course, claims attached to it. So whatever products we have with claims attached to it, they will have to go through the regulatory pathway. One project we are working with the University of British Columbia. In Canada, it will go through Health Canada, which is the FDA's counterpart in Canada. So yes, any product that will have claims attached to it, it has to be regulated. The product that is on the market right now, it's a commercial product which is totally nutraceutical, no claims attached to it, so it doesn't have to be regulated by FDA or any other regulatory agency.
My guest today is Dr. George Anastassov. He is the CEO of Axim Biotechnologies, trading under the OTCQB, and the ticker symbol is AXIM. In closing, Doctor, can we go over a little bit of what clinical trials you guys have in the pipeline, and if there's anything that we didn't touch upon, maybe you want to bring that out to our listeners?
Sure. The clinical trials that we are having or will start very soon are, again, pain and spasticity in multiple sclerosis, glaucoma, IBD, IBS, and Crohn's disease, drug-related psychosis, antibacterial and antifungal preparations, also based on cannabigerol, Alzheimer's-related dementia, and let's see, am I forgetting anything here? It's quite a few. Yes, we will start work on agonist-antagonists for opioid agonist-antagonists for treatment of drug addiction, incorporating also cannabinoids. Smoking cessation preparation, which contains cannabinoids and very small doses of nicotinic acid. We have a whole array of consumer products, as I said. Of course, the eczema and atopic dermatitis, which is undergoing right now studies. And I think what is most important to say is that we have a deep line of intellectual property. Every product that we produce is based on a proprietary intellectual property. And actually, every phase of production is based on our intellectual property. We have intellectual property for extraction of cannabinoids, which produces the highest yields and doesn't use any toxic solvents. We have intellectual property for conversion from lipophilic to hydrophilic, meaning oil-soluble to water-soluble, because all the cannabinoids are lipid-soluble or oil-soluble. We have our own microencapsulation process. We have our own process for prevention of oxidation of tetrahydrocannabinol. So, yes, we have a deep line of intellectual portfolio, as well as of course, clinical applications.
Well, my guest today has been George Anastassov. He is the CEO of Axim Biotechnology. George, I want to thank you for taking time and coming on the show today. And we're going to check back with your company in a couple of months to see how things are going and see where the process is at.
Fantastic. It was a pleasure talking to you, and we'll be glad to be on your show anytime in the future.